Welcome back, everyone. Next, we have Regen BioPharma Inc. Trades on the OTC Pink sheets under the symbol RGBP and is a biotechnology company focused on developing innovative treatments using autologous cell therapies, RNA, DNA-based immunotherapy, and small molecules in the immune-oncology and autoimmune disease space. Please welcome President and CEO David Koos, as well as Harry Lander, Senior Scientific Consultant. Nice to see you, gentlemen.
Well, good morning. We're glad to be here this morning, and I'm excited about finally being able to talk about what's going on with the company.
Perfect. Well, the floor is yours, and you know to call me back when you're ready for questions.
Perfect. So I would like to start off this morning with, over the last, 4 months, I've gotten a lot of emails and calls and things like that regarding what is this quiet period that we're in and why are we in it? So we were in a quiet period when we were in registration, and that continued through the time that the offering was open, which means basically the company cannot use being in a registration period as an item that they can promote or somehow use for investor relations purposes. So they intentionally put a lid on any comments that we can make, with the exception of if there is a material event that comes up and we are required to post that under an 8K with the SEC. Those are by and large permissible. But other than that, we can't have press releases. We can't do any sort of public relations, do conferences or anything like that while we're in the registration period. Now, what constitutes the registration period? Well, that's a time from when you file your S1 registration until you close out the registration, meaning that you have either raised all the cash that you needed to raise, or you've withdrawn the registration as we did. So after that point, you can comment. But during that that period in time when you are open under the registration, you're just not allowed to communicate at any level on any topic that the shareholders would love to hear about. It's a matter of you're not allowed to hype your company. You're not allowed to get out there and do any investor relations work, which is kind of not really useful if you're trying to raise money. You would like to be able to tell the story about the company, but unfortunately, you're not allowed to tell the story. So that may impact how the price of the stock trades in the open market. Now, I know there's been some concern about the S1 registration and that we withdrew it without raising any capital from it. Okay, so the unfortunate thing is we filed for a price on the registration of $2 a share. Now, what that means is that it's a fixed price. We can't say, well, I'm going to sell a number of shares over here at such and such a price and a number of shares over there at such and such a price. It's actually fixed at $2. Now, the unfortunate thing is, in our case, the stock briefly traded over $2, which made the registration a worthwhile event. Unfortunately, it didn't stay there very long, and we've been trading, I don't know, between $1.50 and just under $2 for most of the time we've been in the registration period. So no one is going to buy stock from the company at $2 a share when they can buy it in the open market at, let's say, $1.75 a share. So that makes it really difficult when you're looking at a fixed price because you have no control over what the market does. Now, what does that mean for moving things forward? Well, obviously the goal is the company still wants to raise money. We're currently looking at different options that are available to us. Those would be from private placements to debt financing. But I say debt financing carefully because we're not interested in doing anything toxic that would undo all the hard work we've done over the last couple of years at cleaning the balance sheet up. We want to make sure that if we're looking at debt financing, it's a straight note as opposed to some death spiral convertible debt. A private placement would allow us to do a placement of stock at or somewhere around the current market price, and we wouldn't be locked in to the actual fixed price that we were on the S1. So we would have some latitude with the pricing on that, which would be good. It'd be helpful in getting this done. I think I've seen a few hostile comments on the company's Twitter page, and the purpose of this call today is not to stand here hat in hand and hoping that people write checks. The purpose of this call today is to update you as to where we stand and what our game plan is and how we're moving forward. That being said, to this point, the money that's gone into the company, I've put in there. And we'll continue to put it in there to make sure that we move to a point that we can get funding for the company. Summertime, people tell me is not the best time to try to raise capital, but it's not going to stop us. When I came back on board this company in March of 2021, the company was at death's door and on a resuscitator. So, a respirator, yeah. So, since that time, I have cleaned up the majority of the debt that the company has had. I have gotten all the patent applications that were on file back in good standing. We have gotten quite a bit of things going with the research side of things, and quite honestly, it's been a Herculean task, but we've moved forward. My chief scientific consultant, Harry Lander, has been a big part of moving this project forward. We feel that we have intellectual property that is meaningful for the future of cancer and autoimmune disease. Excuse me a second. I haven't had my coffee yet this morning. So we believe in the company. So much so that all the work I put in over the last couple of years, I haven't taken a salary in the company, and I haven't accrued a salary ongoing in the company. I'm looking at it from the standpoint that there's an opportunity to make a lot of money and to do a lot of good out of the direction this company goes in. So my goal is to make sure that we keep the company moving forward and not incur any death spiral financing that would impact that. Taking a step back, I think one of the emails I received was asking about the magnitude of the reverse stock split and how I feel about it today. At the time that we did the reverse stock split, we were in discussions with an entity that had indicated to us that they would put up the money that we needed. However, upon completing the reverse stock split, they weren't happy with the stock price and a few other things. They walked away from the deal, which was unfortunate because we went through a reverse split based on a very potential outcome. Not the end of the world, a little frustrating. I think any way you look at it, the amount of shares that we had outstanding at the time, we needed to do something. I mean, there was like 100 shares. What was it? Something like everybody in the world could have one share of our company's stock. That's how many shares we had. So the goal here really was to, I think, shrink the number of outstanding shares. Hindsight being what it is, I'll own that. I may have been a little aggressive in the amount of the reverse, but that's water under the bridge, and we have to move forward and do what we need to do to keep the company moving. So the goal here is to take what we have, find the appropriate venue for raising capital for the company, and make sure that we're able to advance the science. I've got other questions that have been asked of me. Where do we sit on increasing the management team? And that's a fair question. To increase the management team right now, I need to go out and raise money for the company, which I've been doing, working on. I don't want us to be a typical biotech company that goes out, gets enough money to set up a bunch of scientists and management types, and then 6 months down the road, you run out of money and you can't keep them on board. The goal here is to move the science forward, to make sure that we do it in a way that is both expeditious but parsimonious with the way we spend capital. Let's see. And I don't mean to stare off at my list of questions here, but I thought today, since we've been silent for the 4 months during the quiet period, I wanted to get as much feedback and input from the shareholders as possible. I know what I think needs to happen, but I want to see where your concerns lie. And the best way for me to do that is for you guys to email me questions that you have about what you want to see happen. You can send questions in on this forum right here. I would like to get to as many of those questions as possible. I think during the course of this presentation, I want Terry to update on the intellectual property that we have, both perfected patents and patent applications. It's substantial by any stretch. And I think it's worth noting what it is that we really have as a company. I think we have opportunities to do some joint ventures that I'm looking at seriously. And the goal here, really, today, is to try and communicate where we sit as a company and let the investors, shareholders, stakeholders know that's the case. know what it is. For some reason, I'm dried out this morning. Let's see. I think what I would like to do is to have Harry take a few minutes and talk about the intellectual property, what's going on with scientific activity, and kind of bring you guys up to speed. Then I'll come back in, wrap things up, and then we'll go to questions from the audience. Harry?
Thanks, David. Hello, everyone. So, pleasure to update on the science. Not too much to update, but things are still moving forward. For those of you who are not necessarily familiar with the Regen portfolio, we're really focused primarily on the immunotherapy of cancers. We look at autoimmunity as well. We have a main target called NR2F6, which is a checkpoint target, clearly a very important target in immunology and tumor biology. We've developed small molecules against it to inhibiting it and activating it. We have genetic approaches to it to knock it out. And in fact, a paper just came out, an important paper just came out recognizing that this is, again, confirming that we are definitely, I think, on the right track with this target. They looked at maybe 48 genes in a melanoma model, and NR2F6 was the #1 gene that predicted tumor genesis. So it's clearly a very important target. So I think the science is very solid. I feel great about it. I'm glad I don't have to deal with any of the business side of things, but just to focus a little bit on the science. And we just got another patent granted, focusing again on NR2F6, inhibiting NR2F6 in cancer in combination with CBD. It's an interesting approach. And that makes I think that's our 11th granted patent. So we have a nice, strong patent portfolio. It's not all on NR2F6. We focus on other approaches too. For example, on endolamine dioxygenase, another target for our D-cell vax, for which we have an IND cleared, and would love to start a clinical trial around that one day. But yeah, so on the science side, we have, I think, a really strong patent fence around the NR2F6 activity. There's a lot we can do on the small molecule side, on the genetic approach as well.
Harry, let me jump in for a quick second here.
Of course.
So we have 11 patents that have been granted. How many patent applications do we currently have on file?
We have 15 on file. It takes time for those to progress through the patent process, of course. But so we'll be very actively moving those forward as well as they go through the patent system. So the small molecule approach, the genetic approach to NR2F6, and we of course have patents outside that. Again, on what we call D-cell vax, on cell therapeutic approaches, using entirely different approaches, because I always think it's important to diversify risk, of course, as a company. So we also have other approaches as well. All of them backed by very good science. So
let me interrupt for another second.
Yeah.
So the paper that you mentioned showing the interest in NR2F6. Now, there's some clarity on that. That was an independent entity, not affiliated with Regen at all, that happened to see this and views it as a significant area to move forward as a small molecule therapy is developed.
Yep. Yeah, they came out of the NIH, the Scripps or the La Jolla Institute of Immunology, very, very well-known group that did a very sophisticated study looking at melanoma and the role of NR2F6, because we've been focusing on NR2F6 in immune cells, which they've done as others have done in this group as well, and knocking it out. They do it genetically because no one has a small molecule inhibitor except for us now, and they see that greatly activates the immune system. But they ask the question, well, what if we knock out NR2F6 in the tumor cells themselves? And that's why it was a very important paper. And sure enough, if you do that, the tumors become even more prone to anti-tumor activity. So clearly NR206 is a very, very important target.
Okay. So that definitely is a third-party support for the direction we're going in.
Yeah, yeah. And we have an ongoing experimental program with a CRO looking at a genetic approach to knocking out NR206 in CAR T cells. We call them DuraCAR. And with the idea that by suppressing NR206 in these T cells and using the CAR T approach, we're going to sort of create these, I don't know if the right word would be monster or souped up CAR T cells. So that's also an approach we're investigating as well.
Now, the CAR T cells, what exactly is a CAR T cell?
So T cells are part of your immune system that your body uses to kill infections, to kill tumors, because tumors pop up all the time, but your body destroys them normally. And CAR T cells are T cells that are taken out of your body, and they are modified to recognize your own tumor, a specific tumor target, E19 it's called typically, and then it's reinfused back into your body. So these CAR T cells then home in on your particular tumor because of the modification. So it's used and it's very successful for liquid tumors, and it's being used by a couple of the big pharma companies and generating billions of dollars in years of per year of sales, and it's saving a lot of lives. It's curing cancers. It's really remarkable, but it's a complicated and expensive drug. So there are many ongoing approaches to improve it.
Okay, let's see. What? Just a second. Okay, let me jump back in on. I got a question that came in to me via email, and they were asking about $5.2 million market cap. Okay, clearly we have been hit with some market activities out there of people selling their stock, shorting the stock. We feel that the price of the company or the fair value of the company exceeds dramatically over where it trades at currently. The problem that we have is that the marketplace, for whatever reason, has evaluated us at the current level. I think that now that we're out of the quiet period and we can get more information out there as to what we're doing, what our research is doing, I think we should start seeing some positive impact on that. I see that according to my clock, we've got about 5 minutes left. I think that we might be able to go over that. I would like to actually take a quick jump into questions that we've gotten, because I really, out of today, I want to pull the Band-Aid off, and I want to make sure that everybody has an opportunity to voice whatever concerns or questions they may have. So let's see here. Anna, are you out there?
Yes, sir, I'm here.
Okay. You want to throw some of the questions at us we got?
Okay, we've got so many questions, and yes, we can go over a little bit. First of all, can you explain what CART means and how does it benefit Regen?
I'll leave that for Harry.
Oh, CAR T cells. Yeah, so I sort of explained that, but those are the T cells that are taken out of the body, modified, and reinfused. And as I said, Regen has an approach to create these super souped up CAR T cells, and that's part of one of the areas we're working on.
Perfect. I just wanted that clarified. Let's get to for David. Investors would like to see a new collaborative partnership with a big name, established company with upfront funding in the millions attached to a deal that would help the company finance the research and development of its drug programs. So what are the prospects for reaching such a deal? And has the company been reaching out to other companies in an effort to secure such a deal?
Well, I think the answer to the question is yes, we're interested in doing something like that. Yes, we're in ongoing talks with different entities that could prove to be helpful in any kind of a joint venture. I think some of them have indicated that they thought we were a little bit early for them, but they have definite interest as we get through some of the preclinical kind of activities that we're involved with right now. So I'm not concerned with finding a partner once we get into phase one. We need to make sure that we've done all our homework and get everything done on the preclinical side of things, and then we'll attract, I think, a lot of capital.
And can you speak about any other potential financing opportunities surfacing? Has anything come up lately?
Well, I think we've got some people that we've talked to about doing a private placement, and we've got some other groups that have indicated they'd be interested in some sort of debt financing. But here again, I got to be careful. I want to make sure that I know what all the trapdoors are on the debt financing, because I don't want to entertain any sort of toxic debt financing for the company. Currently, we don't need to, and there's no sense in going out there and getting ourselves back in the hole that we just crawled out of.
And on the last conference call, Harry, you stated that you would have results from the preclinical trials. Can you share some more of those with us?
Yeah. So the CRO, the contract research organization that we contracted with, has continued to move the research forward under my supervision. They have designed the CAR T elements that are needed. They've inserted them into cells, T cells. They've gotten the results, which they've just shared with us, which are extremely interesting. We're going to continue. Let me put it this way, because I can't reveal what the results are. But I think the results are so interesting that we want to confirm, or at least I wanted them confirmed with another CRO, so that we have dual confirmation. So let me leave it at that. But the results are extremely interesting, and I think we'll be able to, if they hold up, which there's no reason they wouldn't, we could likely file another patent around that information.
Well, beyond that, I think Harry's being very conservative in the whole thing, and I don't necessarily want to, quote unquote, let the cat out of the bag prematurely. But I think that this is very exciting to me. I think it's very exciting to Harry. And I think it represents a great opportunity for Regen.
Another investor question. You stated in one of your previous conference calls that you would accept minimally on a buyout of the company, which was $1 billion. Do you still feel that way with the patent portfolio you possess?
I don't think we ever made that statement. I think there's some investors out there that thought that. But I would still say that based on fair market values of companies that are in the small molecule space, as we mature and get into clinical phase one, I see that we're going to be in a position to be very attractive to a lot of big pharma companies. And I feel that anything that occurs at that point, whether it's a buyout, a joint venture, that's down the road. But definitely there are a lot of companies interested in the space that we operate in.
Another investor says they have a substantial investment in the company for over 2 years. Is there any hope in the near future that we'll see significant progress, or is it another 1 to 2 years away from that?
Well, the thing about biotech, it can happen overnight. It can happen down the road. This is not like buying stock in Walmart. At the end of the quarter, you can see whether they did well or they did poorly. In our situation, we're completely driven by research and the outcomes of various points in time in our research. So you can't really say how long it's going to take. And you have to be involved with the path and not the outcome near term. I know that sounds a little zen for this time of day.
And we're trading at $5.2 million market cap with the portfolio of patents that we possess. What should be a fair market cap based on the industry average?
That's a tough question, I think, to answer, because I think you can't just say that you have 11 issued patents and 15 patent applications and then assign some sort of multiple to it. It really depends upon the value of the company, depends upon how far down the road you are in your research. And if you're moving into or close to phase 1, certainly the company's worth more than it is preclinical.
And Chad Dyring wants to know, are the doctors that you brought in from Penn still on board?
Yep, they're still on board. Just spoke to them last week, but absolutely still on the SAB and active. As our research gets more active, they will be more active. They're focused on the CAR T space, but absolutely.
And Jimmy wants to know, is there any possibility that the company may be dissolved?
I'm not seeing any reason to, unless suddenly I see the weather temperature in Tahiti looks a lot better than San Diego. I know that if you look at the financials, the balance sheet, it tells one story. What you don't understand is I'm behind the company, and that means there's no reason for it to be dissolved.
And Chris Hanscom wants to know, what's the status of the ProMab results that were expected during last conference, and the status of the licensing deal with ONPH and the development of the shared IP?
Well, I'll take the ONPH question. ONPH is not, according to OTC Markets, has not been current with its financial filings, and appears, based on the notifications they posted on OTC Markets under their symbol, it appears that they are going to be probably not, I want to be careful with how I say this. It appears they won't be listed after next week unless they can get their financials in order. So, unfortunately, I don't see that we've gained any real benefit from ONPH at this point. They seem to be able to move forward. They don't seem to be in a position to move forward. Now, that could change. That's just the lay of the land at this point in time.
And regarding the other question regarding ProMab, yep. So that was the first CRO we started working with. Then we elected to use a second CRO for the results I sort of described to you. And exactly, I would like to go back to ProMab now and have them confirm the results from the second CRO, and hopefully we'll be able to get the funds to do that and confirm these results.
And from Frank Sebastian, is your technology continuously being developed? And who is doing the research?
Well, we've got several CROs that are involved with the research. And the reason we have several CROs with the research, or doing the research, is that it's more cost effective for us to outsource to a third party the research than to get a large lab, staff it up, and keep it completely operational. It's much better at this stage of the game for us to have a contract research organization that we work with.
Marcy Gilbert wants to know, are you still performing the intended clinical study planned for August?
Clinical study plan. I think perhaps the person who asked the question may not have phrased it the way that perhaps they should have. So I believe they were asking, because we were expecting the results that I just talked about by August. And sure, and so the answer is we got the results. Okay. They are so unexpected that we need to confirm them in an orthogonal way.
Got it.
We don't want to get overjoyous until we have a confirming study done.
And Jack Estes asks, are you exploring being acquired or merging with other biotech players?
I'm sorry, I missed the first part of that.
Are you exploring being acquired or merging with other biotech players?
Not at this point. I think we're in a position that if we advance, we're able to advance the company into phase 1. We will have demonstrated by that time the value of our science, the value of our intellectual property. At that point, it's open. But until that point, we got some homework to do. And I don't want to sell the company and not be in a position that we have maximized what I feel the shareholder value is.
Well, we have a comment from Kyle Harrison saying, take your time, Koos and Lander, we're in good hands. I love hearing the no toxic debt financing, and that once we're through with the preclinicals and in phase 1, it will bring more interest for joint ventures and deals in the future. So he's happy and he thanks you both. Do you guys have any closing remarks for our viewers today?
I'm very happy that he listened to the presentation and actually made comments based on what we said. No, we appreciate the opportunity. If anyone has any other comments or questions, feel free to email me. I think, do we have my email posted someplace up there? I have it on my press releases that are out. Okay. So yeah, definitely get in touch with me. We have a limited time today, so I didn't think we'd get through everything, but we really appreciate you having us on board here today, Anna.
Perfect. We're so happy you guys came back, and we always look forward to your updates.
Thank you.
Right. Thank you.
All right. Okay, everyone, stay with us. For those of you wanting to stream the Odyssey Health presentation, we are sorry to inform you they've postponed for a future conference, but we will be back with Big Screen Entertainment Group at 1:10 Eastern Time. We'll see you soon.